And welcome to the North Carolina Museum of History and the 21st Annual African American Cultural Celebration. The Sister Circle with Dr. Rasheeda Monroe, Dr. Nerissa Price, and Daly-Mack, RN, will begin in just a moment. But we want to start with a few notes. Remember to ask questions in the chat, and we'll do our best to respond to them and share with our presenter. Please note that our presenters and off-camera crew are masked for the safety of everyone. We thank the following sponsors of the North Carolina Museum of History Foundation for helping to make this event possible.
Good afternoon. My name is Daly-Mack, and I'm a member of the advisory board of the African American Cultural Celebration. And I am very pleased to be here today talking about something that is very near and dear to my heart as a registered nurse. Today we'll be talking with Dr. Rasheeda Monroe and Dr. Nerissa Price. They are members of what has become known as the Sister Circle, or should I say the famed Sister Circle out of Wake Med. You may have seen them highlighted on WRAL. You may have read about them in the News and Observer, or you may have even seen Wake Med's commercial that highlights what they have been doing around COVID vaccine equity in our community. And we're just so grateful that they are able to join us today. Welcome, Dr. Monroe and Dr. Price.
Thank you so much. We're so excited to be here today.
Thank you.
And so can you just share with us the journey? How has this come to be? I mean, everybody that has been awake knows about COVID and all that's been going on. But there's some pretty wonderful things that you and your team have done. I mean, I feel like I'm in the presence of rock stars right now, and I'm kind of geeked out about this whole thing. So please just share with us.
Well, thank you so much. And the feeling is mutual because we've all been doing a lot of work over the past, several months and years as it pertains to COVID-19. So we are all in the presence of awesomeness. But I'll start first. So I'm Rasheeda Monroe. I am a pediatrician and medical educator. But at the height of the vaccine distribution efforts, in the winter and spring, I found myself working with a team of 6 Black physicians, again, the Sister Circle, and hundreds of volunteers as advocates for equitable vaccine distribution. And we partnered with people like honorary Sister Circle member Lachelle Wardell at Wake County Department of Health and Human Services, and local faith leaders and pastors who are known and trusted in the community to help deliver vaccines when the supply was so low and so limited. And so I'd like to tell you guys a little bit about that journey. And again, I'm joined today by fellow Sister Circle member, Dr. Nerissa Price, who you'll hear from in a little bit. But if you would, just give me a couple of minutes to talk a little bit about the journey and the things that that led us here. So, as everyone is well aware, throughout the course of the pandemic, we've seen how communities of color have been particularly impacted by COVID-19. You saw news headlines that repeatedly told us that Black and Brown communities were being hardest hit by the pandemic. There was one in particular from our local news in the fall of 2019 that demonstrated that specifically the 27610 zip code in Southeast Raleigh was leading the state in the number of cases. And 27610 is the zip code in which I practice as a primary care pediatrician at Wake Med on our Raleigh campus. And in that zip code, 64% of the residents are Black. So I was seeing how this played out in real time with the families that I care for. And at that time, 65% of the cases in North Carolina were seen in African Americans when we only represent 21% of North Carolina in general. So in the fall of 2020, when we were seeing 3 times the rate of hospitalizations and deaths in Black communities as compared to white communities. Unfortunately, again, we are seeing some of those same disparities during this current Omicron variant surge. But we have to ask ourselves, why? Why do we see these disparities? And we talk about the social determinants of health as the conditions where people live, learn, work, and play that affect a wide range of health conditions. We think of the social determinants as healthcare access, education access and quality, social and community context, and neighborhood and built environment. But when I think about this as it relates to Black and Brown communities, including Southeast Raleigh, I think it is so, so important that we remember and discuss the historical factors that shape these communities. So we have to understand these historical factors that shape the communities are by design, and that local, state, and federal policies legislated them into existence. Local federal state policies like redlining, the federal highway system, school segregation, and generally the legacy of mistrust in medicine amongst communities of color. So I want to highlight a couple of them briefly today that are specific to the social determinants of health and the communities in and around Southeast Raleigh. And so while we remember these tools that were used or are used to disrupt healthy and prosperous Black communities, we must understand that this is not unique to Southeast Raleigh, or our state. These same stories can be told over and over throughout the United States. So the first example I'll give is written in one of my favorite historical books. It's called The Color of Law by Richard Rothstein. And it describes how school segregation was used as a tool to disrupt two Raleigh neighborhoods you may know, College Park and Idlewild. And so if you would allow me permission, I'd like to read an excerpt from that book. So Karen Benjamin, a historian at St. Xavier College in Chicago, has uncovered records that reveal how school placement decisions helped force the segregation of Raleigh as well as Houston and Atlanta. In Raleigh in the early 20th century, neighborhoods of Black and white concentration were scattered across the city. They included two relatively prosperous African-American neighborhoods, Idlewild and College Park, on what was then the city's northeast side. These middle-class communities of owner-occupied single-family homes no longer exist because in the 1920s, the school board decided to transfer all schools for Black students to the far southeastern section of the city, where planners hoped to isolate Raleigh's African Americans. Making matters worse, when the board provided Idlewild and College Park's middle-class residents with a new school, it put the campus next to the city dump and a rock quarry filled with stagnant water. At the same time, it established the newest and most well-equipped schools for white students in the far northwestern neighborhoods. In some cases, these areas were still largely underdeveloped, where real estate interests hoped to attract white families. There was nothing hidden about the racial context of these schools' site decisions, and they generated considerable debate. An editorial in the moderate Raleigh Times said, "The Negroes making protest are of the best element of the race in Raleigh. Many of them live in the northeastern section, already occupied by numerous growing populations of Negro citizens, the majority of whom own their own homes. They have built up with who knows what sacrifice a self-respecting and steadily improving community. It is a fact well known that the northeastern Negro section was largely to the desire of better class Negroes to escape the very rock quarry locality in which it is suggested that the new schools will take place." So I really like that quote, and remembering that, because if we think of, the southeastern Raleigh between a rock quarry and the town dump, we know exactly where that is today. And we think about this still mostly segregated section of Southeast Raleigh and, the current pandemic and how things have fared in Southeast Raleigh. So That's one example. The second example is from the documentary called Oberlin, A Village Rooted in Freedom. And it demonstrates how the federal highway system and city planning were used as a tool to disrupt the village of Oberlin. So I'd like to share this, this quote. So this is Oberlin, or was Oberlin, for it is gone, merged into a growing metropolis at a loss of its distinctive character, caught in the whirlpool of progress. A Negro town formed not of necessity or compulsion, but the zest and vitality and charm. It produced artisans and artists, doctors, lawyers, dentists, preachers, and teachers at a rate above the average of the city as a whole and above the average of the state that it contained. I was born there in the dear, dear days long ago, and that's from Lemuel Graves, 1950. And then a reporter in 1948 discussed in the News and Observer that Oberlin was a premier African-American suburb in Raleigh of approximately 1,000 residents. Esteemed by both races in their industry, frugality, and high character. So despite this prosperous neighborhood, Black neighborhood that was held in high esteem, in 1954, Wade Avenue was built and split the community in two. Many of the homes were sold or demolished for the project. And so if you know Raleigh, our capital city, the city of Oaks, as stated in the documentary, you can see how the head of Oberlin was cut off by Hillsborough, the feet by Glenwood, and Wade Avenue gutted it right through the middle. But this was the norm in Black America. It always seemed like the best way to build, was always through a Black community. So families during this building project were displaced, the sense of community was lost. And again, the socioeconomic and psychological impacts are still felt to this day. And this wasn't new. Or unique to our city. New highways and public housing almost always intentionally targeted Black communities following the Federal Aid Highway Act of 1956. Highways were built at the same time that courts were striking down racial zoning and other restrictive laws. And so it was seen as almost a legal workaround to thwart integration. We don't have time to go into several other examples, but I think about St. Agnes Hospital in Southeast Raleigh, which was described to me as the only place a Black person could get good care between Washington, D.C. and Atlanta in the first half of the 20th century. And when the desegregation of our county hospital in the mid-1960s, now known as Wake Med Hospital, where I work, that essentially closed down St. Agnes. And decrease the community's access to healthcare and close down the economic engine that was St. Agnes. When you think about the local florist and gas station and funeral home, all of those economics were tied to that hospital being located in Southeast Raleigh. And again, those effects can still be felt today. So when we think about the generations of intentional disruption and lack of investment, and we collide that with a global pandemic, we shouldn't be surprised that communities of color suffer disproportionate impact. And so our goal as the Sister Circle and our health equity team of volunteers was to be equally as intentional with our approach to close the vaccine access gap. And so we utilized some of our community partnerships with Black and Latinx churches and community organizations. We reached out to Divine Nine, the Mexican and Guatemalan consulates, mosques. We used data that was supplied to us, again, from Wake County, Lachelle Wardell, to be laser focused in our approach. We used a strike team model, and we were able to bring vaccines into the community. So we would help remove some of the barriers to access, like transportation or the need for a computer or internet access to sign up. We sent trusted messengers like the Sister Circle, and many of our strike team leads were men and women physicians and practitioners of color. Our volunteer workforce, we had other physicians and doctors and MAs and teachers and community members who volunteered with us. And part of our weekly education, as we talked about where we were going, what the plan was, how we were doing it, was to remind and inform everyone of the importance of our mission and some of the historical factors that helped shape the communities. And there was a significant impact. So we saw increased vaccination rates in Black and Brown communities in Southeast Raleigh. And the needle moved for the state vaccination effort by almost 1% amongst African Americans with each of our vaccine events in early 2021. We built trust-informed relationships and were able to deliver over 14,000 doses of COVID-19 vaccines through these efforts. And, we were just one of the many community organizations, many of whom, may be watching today, who were a part of doing this work to help improve the access. So, we've learned some amazing lessons through this journey, and we hope to apply them in our work as we focus on our work through a lens of equity. We realized how important our voices were. People trusted us. We were able to make the connections, educate people, and allay fears. We learned that our experience and ideas were really valuable, and people throughout the state and beyond connected with us to learn what our model was to help kind of spread that throughout. We leveraged our community partnerships. So many of the pastors and faith leaders gave us access to their space, their relationships, their volunteers in their churches and mosques and organizations, access to their congregations, and their trusted voice to give us more credibility in the community. So I'll stop there. I could talk about this forever, but I hope we learned something today, and I hope people are inspired to use their own voices and advocate with a focus on equity as we approach things like this in our community.
Thank you so much, Dr. Monroe. I think it's very important that we learned about the historical context about how a lot of this came to be. And we found in rural northeastern North Carolina some of the same things. And one thing that we did discover out of this pandemic is it's very important that people work together and collaborate. And so we also had local hospital, clinics, federally qualified health centers, the health department, and churches helping people get tested and vaccinated. And I just think what you all have done is just phenomenal. And we, again, are so appreciative. Dr. Price, can you share your experiences with us, please?
Yes, thank you so much. So, just piggybacking on what Dr. Monroe was saying, that for me, this was such an exciting time for us that it, for a small group of determined African-American women to bring about such a big change. And, as she highlighted, these issues of health inequity really aren't new. And what I often heard somewhat discouragingly so, that it was often said that in the beginning, that the reason why we were seeing such inequities with Black and Brown communities as far as death from COVID was because of some of these longstanding health inequities. And, even leaders in the vaccine movement would acknowledge that, yes, these have long been here, but what do you do about it? And that hit us really wrong, that there are things you can do about it. We don't have to give up or say, oh, this is too hard a problem to overcome. And so what I have been trying to do is to really think about in this next phase, really what's next? Because this was such a powerful and effective model with having trusted members from the medical community to join with members in trusted community members. And then we were able to make a huge inroads with inequity. So if the vaccine equity issue is a model for how to approach other health inequities, how should we continue that and be true to really those to those lessons that we've learned? And so for me, the what next was looking at that. How do we come up with more sustainable models? And a lot of that, I think it's important to recognize where we are with certain health disparities in North Carolina, for example, that breast cancer deaths still amongst African Americans are the highest. that even though heart disease is the leading cause of death for all North Carolinians, that for African Americans, we outpace any other ethnic group for heart disease death. We also find that infant mortality amongst African Americans is more than twice than of our white counterparts, and that our new diagnosis of HIV for the African Americans is at a rate 8 times more of whites. And so when you look at that, and again thinking about the model, it gives you an idea of maybe an approach to really start to work on those health equity issues. The other element for me where I asked what next was that I became very keenly aware, being a psychiatrist, that as we were very focused on COVID numbers and concerns about infection and then vaccination rates, that I was seeing a parallel pandemic that was occurring with mental health, that people were presenting to the emergency departments at alarming rates with drug overdoses, with being in the midst of mental health crisis with suicidal thinking or suicide attempts at really an alarming rate. And that even, for example, with opiates, that even though we've maybe traditionally thought about the opioid epidemic maybe affecting our white community members more, what we found or are finding is that for African Americans and Indigenous people, that we're outpacing our overdose rates much more. And so, there's a lot of work to be done across the board with physical health inequities, but also mental health inequities. But it's been really inspiring working with this group of women, because it really reminded me that I'm not alone in this, and that in fact, there are a lot of people that once you lay it out there what the issues are and the concerns are, that they're willing to help you. And so we're now focusing, particularly at Wake Med, looking at ways that we can invest more in our community. As Dr. Monroe stated, we're right in the middle of the 27610 zip code. And it's more than just talk at this point. Money is being placed where our mouths are. And so we're doing some exciting things with really focusing on this issue and really hoping to use this model more and more to really tackle the other areas of health disparities in North Carolina.
We'd be remiss not to name the rest of the Sister Circle members. We keep saying Sister Circle, right? So I just want to give a shout out to Dr. Jacqueline Hicks, Dr. Tiffany Lowe, Dr. Michelle Benoit Wilson, Dr. Natasha McLawhorn, who are, continuing to do work in different ways through education and interactions with patients. But I just want to give a shout out.
So important.
You should tell people a little bit about the effort, kind of the door-to-door, hand-to-hand combat that you've been in with your teams and volunteers. Tell us about that.
So again, kind of this not wanting the momentum of all the work that we were doing to end, and really recognizing that there was still a lot of need in our community. We decided to try to impact some of the vaccine equity issues related to folks that were still having problems with access, particularly homebound individuals. And so when you think about it, for a lot of the homebound folks, many of them were elderly and they wanted to get the vaccine, but really had no easy way oftentimes to get the vaccine. And as particularly at the time when we were wrapping up some of our big vaccine efforts. And so we partnered with Meals on Wheels, and we had volunteers who went door to door and vaccinating people. And we vaccinated over 80 seniors at that event. But then there was still more effort, and Wake County decided to launch another effort called Doses to Doors. And what this did was really use census data to target neighborhoods that had low vaccination rates. And then they would send out community health workers, oftentimes individuals who came from those communities, and would knock on doors and say, hey, we're here. We're going, if you want to get vaccinated, we'll come in your house and we'll get you vaccinated. And so I was often paired, and other healthcare workers were paired with these community health workers with my supplies, my vaccine supplies on my back. And it was amazing and really successful. Like I almost didn't believe people would let us just come in their house and give the vaccine, but they were so excited and really happy to know that they had not been forgotten. And so even now, I still have a number of those communities.
Can you hear me now?
Yes.
Yeah, I see something moving.
Awesome.
Yay.
Yay.
Woo! Well, I've been taking notes. So while I was in the dark, I was listening to everything you were saying, especially about using data, because in addition to being a nurse, I'm also a real computer geek. And the ability to use data has been phenomenal, even where I work, and using that census tract information. And so I'm glad to hear that I'm not alone in that. So we do have a question. Is the Sister Circle involved in mentorship at the medical school level as to how to engage in this type of work?
Yes, that's an excellent question. I'm excited to answer it. So I serve as the campus director to the UNC School of Medicine for the Raleigh area site. So the students who are in their clinical phase of medical school, called the third year of medical school, spend time for a year on our campus. And those students engaged with us during some of our vaccine volunteer efforts. So they were vaccinating people, they were helping with data entry. Some of them we were doing like the door-to-door campaign with Dr. Price, but also many of the Sister Circle members have served as mentors or educators to the medical students. Dr. Price gives a wonderful talk to the medical students about health equity. Dr. Benoit Wilson just last night did a fantastic presentation on maternal morbidity, mortality disparities in Black women. And so, and I know Dr. Tiffany Lowe is very involved with the Campbell Medical School. So absolutely, that's some of my favorite times are in my mentorship with the UNC medical students and the Keenan Urban Scholars who spend time on our campus.
And
that's really great. Because I'm
one
sorry.
thing that we're
I know that this is going to go forward. Go ahead.
I'm sorry. One thing we're hoping to expand, when you look at health equity work, you really do have to look at the pipeline and ways to improve, people to have access to on their way to medical school. So we're hoping to develop relationships with some of our local HBCUs on a more recurrent basis. They were wonderful partners with some of our vaccine efforts, but we want to keep a closer eye on these, bright, wonderful minds and get them some of the exposure to medicine, because you just never know. They may be, our future solution. And maybe can continue some of the work that we've started.
Absolutely. And a lot of the lessons that we've learned during this pandemic, a lot of the things that we're doing now are going to continue forward. Like when I think about telehealth, telehealth wasn't being used very widely prior to this pandemic. And now it's actually being used quite frequently. Now, the difficulty in my community is when you're out in a rural area, there's not enough broadband for a lot of people to take advantage of it. And so as we get more money into the system to build up infrastructure and increase broadband, we're going to be able to do that even more. And speaking of technology, does the Sister Circle have a website or a Facebook page? Because people are going to want to read more about you guys.
Unfortunately, no. um, we're just more of a kind of organic group of women that saw a need and tried to help fill a need. But no, Dr. Price, do we need to get a Facebook page or a website?
Probably in this day and age. And in truth, we have had some really wonderful people that have been inspired by our work who have offered to do some marketing sort of things for us. And so that might be something we talk with our other sisters to see if they're up for that.
I'll be looking for it. I can even help you with that page.
Awesome.
Well, this is really great. I don't see any more questions right now. Is there anything else that you would like to share with us? You do have a little bit more time.
Well, one thing I wanted to say was, the way that we do our work we've pivoted a bit, right? So in the beginning, we were doing these massive vaccination events and vaccinating almost 2,000 people, in a 4-hour time period, spread across, 2 different large sites. And that was early in 2021. And then we did that for months. And then we shifted to kind of these smaller scale because, the vaccine became more available and the people who were eager and the early adopters, I say, had gotten vaccinated. And then we were in these kind of smaller spaces, having, individual conversations or targeting certain groups and, worked with Best Baby Zone to try to get, women of color who were pregnant, get them vaccinated. And then we targeted when it became available for adolescents and then we gave some booster doses to seniors, but these have just been, kind of smaller scale events just based on the time and the need. And, these are conversations that I have every day as a pediatrician with families, and we offer vaccines to anyone who's in the room. If grandma, aunt, cousin, whoever is there, we'll get them vaccinated if they need to be, because we think it's so important to, protect the health of our children, families, and communities. But a lot of what we've done also has been in education. So in town halls with NCDHHS and Wade County and with Fair Count organization. Anytime we can, we want to speak to people and help combat misinformation, answer questions, allay fears, do whatever we can do to do that, because it's almost like we're in a war to get good, real, trusted, truthful, science-driven, data-based information out there, and we're in a fight against others who are doing, the opposite. So I just want to mention that though things look different, the work, I think, is equally as important.
I agree with that wholeheartedly. I do remember the times, even in Halifax County, where we had huge vaccine clinics. And the thing was, in the beginning, we were vaccinating people from even out of state, because like Virginia hadn't caught up to us yet. We had people coming from Michigan. I had someone say they were coming from New York to get a vaccine. We had a large number of people from Washington, D.C. in several of our vaccine clinics. And then it just kind of dried up. And so, like you said, the early adopters, those were the ones that would sit in line. The campus of Halifax Community College had cars wrapped around the building waiting to get in and be vaccinated. And then it got to the point where we would try to get 200 people and only 50 would show up. Mm-hmm. But I am happy to see that quite a few people have come in to get boosted. So, those were the people that were there early in the first place. And it is a fight. It's definitely a fight. The misinformation is a tremendous problem. And we're doing everything that we can to make sure that the right message is getting out and that people understand that vaccines do work. Vaccines are safe and vaccines save lives.
And one thing that's been really nice about some of these smaller type engagements is that I found myself being able to spend more time one-on-one talking to folks who still have some doubts. So even there have been individuals that have maybe got the first round of vaccines, but now it's time for the booster, and they're not sure if they need that. And so being able to take that time now when I do my visits to really answer all their questions, to talk to them, that I found it very powerful. And what's also been really powerful in some of those home type visits is, it's kind of an ideal setting. It's, people's, comfort zone, literally they're feeling they're most secure there. But then invariably there are other family members, and I see them watching, and maybe family members who themselves have not decided yet that they wanted to get a vaccine or any of that. And then after they have like that one brave member of the family, then I'm finding that I get invited back again and again, and I get more and more of the family, who are now kind of on board with the message. And so, there's so many lessons that have really been reminded of us of how we have to engage certain populations differently. Like, we're not all the same in how we deliver our message. And so if we show that we really care, really interested, we want to learn, how to best communicate that message, people have been like amazingly open to it.
Well, I'd just like to thank you both for coming on and sharing this with us today. And I just have one final question before we say goodbye. Do you think I could be an honorary member of the Sister Circle?
Absolutely. We love more honorary sisters.
And we actually have some brothers too, to be honest.
That's true.
I'm all for the brothers. No problem. Okay, great. Well, thank you both. It's been great.
Thank you. Thank you for having us.
Thank you.
Be sure to watch some live performances taking place throughout the day, screening on our website, nc-aacc.com. Thanks for joining us for the 21st Annual African American Cultural Celebration, which continues until 5 p.m. today.